Hello, I'm very glad to be among you today. The third webinar of the second series of ASCO, American Society of Clinical Oncology, GOIS, Global Oncology Implementing Science, International Webinars. Today, uh, the short topic is about brainstorming notes on oncology and AI. I am Ahmed Elzawawy, chair of Win-Win Initiative, chair of a board of directors of Global Oncology Implementing Science. Guys, go you. I'm founder president of ICDoc and ICDoc's experts in cancer without borders. Past president of AORTIC, African Organization for Research and Training in Cancer, professor of clinical oncology, South Carolina University, Ismailia, and former medical founder of Al Suleiman Radiation and Medical Oncology Center, Port Said, Egypt. Disclosure of conflicts, none. Brainstorming notes on oncology and AI, some thoughts to get this conversation started. What does AI mean? This is a question for you to think about. What we suggest is that augmenting or additive or assisting intelligence and not artificial intelligence. Because this artificial intelligence give meaning that it's replace intelligence, maybe, but when we mean by AI to augment human capabilities and not replacing them, rather than the term of artificial intelligence. The abbreviation artificial AI works for all. This surprisingly is augmenting, additive, assisted, all AI. So you not change any abbreviation. Reference for that, we aborted this before in chapter 6, Approaching Global Oncology. Here is the link. What do you think? We never claimed that what we present should be is completely right. So we suggest to conduct an online survey with many to get wider scale views. AI consists of human-made devices or programs that marvelously augment the scope and execution of what was planned also by humans. AI companies hire human beings, personnel to delete the harmful and extremely violent content before it passed to ChatGPT, OpenAI, and AI itself, learning, and others. So they hire human beings to correct and to exclude or to delete harmful material before. By whom? They hire human beings. I share with you this feedback from IBM Watson. This is from Mrs. Dr. Irene Dankwi Molan. This is Deputy Deputy Chief Health Officer, IBM Watson. She wrote to me, Dear Ahmed, thank you for your excellent suggestions. I agree with your comments. I support the use of augmented intelligence. It is from she is from IBM Watson, but she supports the use of augmented intelligence and not particularly supporter of using artificial intelligence because of how it gets misinterpreted or misunderstood to be sort of robot or human being with infinite capacities. These AI tools do really serve to augment the expertise of professionals who use them. She also highlighted the need of addressing ethical and social issues. This is a very important note. Surprisingly, I asked Meta AI And this is the reply of Meta AI, surprisingly. I don't have personal preference. AI, Meta AI itself don't have personal preference. But I can tell you that augmenting intelligence is a popular interpretation in healthcare, emphasizing AI supportive roles. Your question sparked an interesting point. The term AI can be flexible, focusing on how it enhances human capability. Well, we started to make some currents in this calmoter. Finally, Meta AI asked, "What do you think is the most fitting meaning in medicine?" Meta itself asked, "What do you think?" Well, since I ask, what are your thoughts on AI in oncology? I pose the question to all of us. AI role in oncology is growing in all fields of clinical oncology: screening, diagnosis, lab pathology, telepathology, imaging, treatment, and decision, and telehealth and robotic intervention. The question is, how do we keep it humane and evidence-based? Humane and evidence-based. The increasing roles of ICT and AI in professional cancer education and training. Yes, there is a very important increasing role in that. Can AI help reduce doctor burnout and improve their quality of life? Will AI assistance lead to de-skilling of endoscopists and other specialties? De-skilling, reduce the skills. AI may change job markets. Are we must prepare to the next generation to master AI, not the other way around, to master AI, to master AI. In about 20 years, 50% of all jobs will be educated or no longer needed. And healthcare is not an exception. AI is not meant to replace medical professionals, but those who use AI will probably replace those who don't. Who don't. This is very important. The use of AI will spare the needs and cost of salaries and still unknown numbers of human beings. But it will increase the needs for more expensive human workers who are not just users of technology, but who can adapt and develop uses according to the need of their field and work. It's very important. Are we prepared for that with educational programs in different fields for the beginners and young generation, from school students to the workers till the age of 45 or older? Could they master the AI and not the contrary? Master the AI and not the contrary. So it will become really augmenting and or additive or assisting intelligent AI. I have some preference for augmenting, but all are good. What do you think? With innovative division, AI may even bring forward a renaissance in the doctor-patient relationships. Renaissance. What do you think? In some study shows that treatment prescribed by human being oncologist is similar or not far from the treatment prescribed by AI. But I would like to emphasize here that this is because in such cases, in such studies, the clinician follows given guidelines exactly as a holy book. But no, it is not correct. Follow a given guideline on given data without consideration of differences between patients, even if they have the same stage of the disease. AI do the same. Do a guideline and then follow blindly. AI do the same. It just applies the given guidelines. So I would like to emphasize that all this study lacking something. This point. You give, you make doctors now are like a robot, follow the guidelines blindly, and then you ask the AI. Then it will be not far from each other. In cancer care, in medicine in general, in all specialties, of to all colleagues in medical professions, we stress that human being patient is flesh, blood, variable, variable different sentiments, feelings, and different reactions, psychology, different pathology, different response, and different treatment, and to even to speak and to anything. Different response in for difference in mood, difference in response to treatment, different pathological response, and different side effects to treatment. Hence, she or he is not just some shapes and numbers or screens. Please consider this. We are not just shapes and numbers or screens. I pose a question to everyone. If you are a patient, or the patient is a person very dear to you, do you prefer your condition to be managed exclusively according to decisions of AI, or according to a human doctor who master and use well AI, and who feels you, and who consider your human conditions, and tailor the tailor the management according to you? What do you think? What do you prefer? In radiotherapy, for example, and this is I emphasize on this point. Please think about it. We should never count only on colors, circle, and curves on computer or planning systems, whatever is, or in equations on screens, but also on more human evaluation of the output of computers and AI adjustment and tailoring to every patient before, along along the course of the treatment, and then in follow-up. That if we like to do better value radiotherapy. Otherwise, that's make robot guide the treatment. Notes in the study that showed routine AI assistant may lead to lower or the skilling, or to reduce the skills in endoscopist. This is a study, a new study. This title is Endoscopist, the Skilling Risk After Exposure to Artificial Intelligence in Colonoscopy. This was multicentric study. Impact on experienced physicians. Well, contrary to expectation, the study showed that even highly experienced clinicians, those who had performed over 2,000 colonoscopies, were susceptible to this, showing that the effect is not limited to beginners. False positives and cognitive burden. Well, while AI improves overall computer-aided detection systems, frequently mislabel normal structure as polyps, which may contribute to false sense of security, or conversely create misleading visual visual science. Attention for this. False positives. Significant decline in detection rates. A real-world multi-center observational study found that after the introduction of AI, the adenoma detection rate of endoscopies during non-AI assisted colonoscopy dropped by 6%. Implications and recommendations. Not a replacement for training. The studies emphasize that AI should be viewed as a tool to support, not replace, the skills of endoscopists and other specialists. This study was for endoscopy, but it is should be viewed for other specialists also in medicine. Structured training and educational policies to prevent this quiet erosion. I like this term, quiet erosion of skills, of medical skills, and of experiences. Intermittent use, intermittent rather constant use of AI might be strategy to maintain human profession. So we don't are against at all. We are not against AI at all. But intermittent, rather constant use of AI with don't forget to experience your skills and to use your skills with AI. It might be strategy to maintain human proficiency. While AI continues to offer promising advancement in improving diagnostic accuracy, these findings highlight the need for careful evidence-based integration to avoid negative consequences on clinician proficiency. And you, what do you think? Let's start more virtual discussion and brainstorming on AI in oncology after this webinar by sending your feedback and virtual discussion, and eventually to publish the outcome by you. The update and your feedback could be the subject of webinar or more in the next series, our next series of 2026-2027. Please send your feedback, suggestion, or relevant topics to Professor Ahmed Zawawi, feedback at isodoc.website, and for Dr. Monica Sonio. The win-win is a message of love expressed in scientific exploration and collaboration to serve the cause of affordability of better value cancer care with dignity for all. This is our message, and together, regardless of the patient's nationality, belief, or color. In GOIS and the Win-Win Scientific Initiative, we are very open to any suggestion, constructive critics, collaboration, and count in your feedback. Visit our website, gois.website. Thank you all. And this links to our website and implementation science, the message of love for all humans via science. Via science. Well, sorry. We are waiting for your feedback, suggestions, and as usual, we say going forward in fruitful cooperation. And bye-bye. Bye-bye.